If you are over 50 and you have ever woken up with a slight headache, blurry vision, or a strange tightness at the back of your neck, please do not skip this video. What you are calling just getting older might actually be your blood pressure quietly putting you at risk every single morning. Stay with me, because by the end of this video, you will know exactly what is happening inside your body and what you can do about it. Hi everyone, I am Dr. Kaivor, and I am a health specialist. Over the years, I have worked closely with many patients, a large number of them seniors, who did not realize that the small feelings they experienced every morning were actually their body warning them about dangerously high blood pressure. Today, I want to walk you through exactly what this sign is, why it happens, and what you can do to protect yourself. High blood pressure, medically known as hypertension, is a condition that silently damages your body over time. It is dangerous precisely because its symptoms often are not obvious. That is why many doctors call it the silent killer. But there is one window of time when it tends to show itself a little more clearly, and that is the first hour after you wake up. While you sleep, your blood pressure naturally drops. Your heart rests, your blood vessels relax, and your whole system slows down. But as soon as you wake up, your body raises blood pressure quickly to prepare you for the day. This is medically known as the morning blood pressure surge. In healthy individuals, this surge is mild and harmless. In people whose blood pressure is already poorly controlled, this surge can become dangerous because this is exactly when the risk of heart attack and stroke is highest. This is also why a large number of heart attacks and strokes happen within the first 2 or 3 hours after waking up. That is not a coincidence. It is a well-documented pattern, and understanding it can genuinely help protect you and your loved ones. Many families only learn about this pattern after something serious has already happened, and that is exactly what I am hoping we can avoid today by talking about it openly and early. I remember a patient, a woman in her 60s, who came to see me only because her daughter insisted on it. She told me she felt a little dizzy most mornings, but assumed it was simply low blood sugar or poor sleep. When we checked her blood pressure right after she woke up over a few days, it was consistently far higher than it should have been, even though her readings later in the day looked completely normal. That morning pattern was the only clue, and it was almost missed entirely. Stories like this are far more common than people realize, which is exactly why I wanted to make this video. Many seniors notice certain feelings when they wake up, but dismiss them as normal parts of aging. Let me walk you through what these actually look like, because the more clearly you can recognize them, the faster you can respond. The first is a headache right after waking up, often felt at the back of the head or the upper part of the neck. This is not the same as a regular tension headache. It tends to come on quickly, right when you sit up or stand, and it often fades within the first half hour of the day. Many people associate this with poor sleep or an old pillow, when in reality their blood pressure is rising too quickly first thing in the morning. The second is blurred vision or a slight spinning sensation when you get out of bed. Some people describe it as the room tilting for a second or two, almost like a brief wave of unsteadiness. This happens because blood flow to the brain is being affected by the sudden pressure change, and it deserves more attention than most people give it. The third is a feeling of weakness or tingling in the hands, especially noticeable when trying to hold or pick something up shortly after waking. Some patients tell me they drop their toothbrush or have trouble buttoning a shirt in the first few minutes of the day, then feel completely normal soon after. The fourth is mild difficulty breathing, especially when you start moving around the room or walking to the bathroom. This is often dismissed as simply being out of shape, but in many cases it is connected to how hard the heart is working during that early morning surge. The fifth is a feeling of heaviness or mild pressure in the chest that often fades after a short while, sometimes within 10 or 15 minutes. This is the symptom I want you to take most seriously, even when it seems mild, because chest-related symptoms should never be brushed aside without proper evaluation. On their own, each of these can seem minor. Many seniors brush them off because they go away on their own. But when these symptoms happen repeatedly, morning after morning, they are telling you something important. Your blood pressure is rising in an unhealthy way during this specific window, and your body is reacting to it the only way it knows how, by sending you these small signals. You might wonder why this happens specifically in the morning and not at night or during the day. The answer lies in something called the circadian rhythm, which is your body's internal clock that controls far more than just your sleep schedule. At night, while you sleep, your body is in rest mode. Your heart rate slows, your blood vessels relax, and your blood pressure naturally drops to its lowest point of the day. As your sleep cycle nears its end, your body begins releasing stress hormones, mainly cortisol and adrenaline, to prepare you for waking up and becoming active. This is a completely natural process that every human body goes through, regardless of age. These hormones cause your blood vessels to tighten and signal your heart to pump faster and harder. In a healthy person, this transition happens smoothly without causing harm. But in people whose arteries have already become stiff, which is extremely common as we age, this sudden surge creates far more pressure than the vessels can comfortably handle. If you already have hypertension, or if your current medication is not working as well as it should, this surge can push your blood pressure to a genuinely dangerous level, sometimes without you even realizing how high it has climbed. I want to explain why this particular risk is higher for seniors compared to younger people, because understanding the reason makes it much easier to take it seriously instead of dismissing it as just another part of aging. First, as we age, our blood vessels naturally lose elasticity. They become stiffer and less able to absorb sudden changes in pressure. Think of a young, flexible hose compared to an old, rigid one. The flexible one can handle a sudden burst of water pressure without much issue, while the rigid one is far more likely to strain or even crack under the same pressure. This means any spike in blood pressure puts more direct strain on the heart and the brain than it would in a younger person. Second, many seniors are managing multiple health conditions at the same time, such as diabetes, high cholesterol, or kidney issues. Each of these conditions interacts with blood pressure in ways that make it more unpredictable and harder to control. Diabetes, for example, can damage blood vessels over time, making them even less able to handle sudden pressure changes. Kidney issues can affect how well the body regulates fluid and salt, which directly impacts blood pressure as well. Third, and this is something I see often in my practice, many people take their blood pressure medication either late at night before bed or quite late in the morning. This leaves a gap where the body is completely unprotected during the very hours when the morning surge is strongest. That gap is often exactly when problems occur, and it is one of the most overlooked details in managing blood pressure safely. There is also a fourth factor worth mentioning, which is poor sleep quality. Many seniors deal with disrupted sleep, frequent waking during the night, or conditions like sleep apnea. Poor sleep can intensify the morning surge even further because the body is already under additional stress before the day even begins. Before we move on to solutions, I want to mention a few common mistakes I see seniors make again and again, because avoiding these can make a real difference. The first mistake is assuming that feeling fine later in the day means everything is fine overall. Blood pressure can spike specifically in the morning and look completely normal by afternoon, which gives a false sense of security. The second mistake is skipping morning medication on days when they feel okay, thinking it is not needed that day. Blood pressure medication works by keeping levels stable over time, not just on days when symptoms are noticeable. The third mistake is relying only on how they feel rather than actual numbers. Many people with dangerously high blood pressure feel completely normal, which is exactly why regular monitoring matters so much more than instinct alone. Now let's talk about what matters most, which is what you can actually do starting tomorrow morning to protect yourself. The first step is to check your blood pressure right after waking up. If you have a home blood pressure monitor, sit calmly for a minute or two after getting up, then take a reading. Try to do this at roughly the same time each morning, before coffee, before breakfast, and before taking your medication, so you get a true picture of your baseline. If you consistently see numbers above 140/90, this is something you need to bring up with your doctor as soon as possible. The second step is to avoid standing up suddenly. Going from lying down to standing in one quick motion puts extra strain on a system that is already adjusting. Instead, sit on the edge of the bed for a moment, let your body adjust, take a few slow breaths, and then stand up slowly. This simple habit alone can reduce dizziness and the risk of falling significantly. The third step is to talk to your doctor specifically about the timing of your medication. In many cases, doctors can adjust the time you take your dose so that it is actively working during these critical morning hours instead of wearing off overnight. This is a conversation worth having even if your blood pressure seems generally well controlled, because timing can make a meaningful difference. The fourth step is to reduce salt intake, particularly in your evening meals. Excess salt causes your body to retain more fluid, which can make the morning blood pressure surge noticeably worse. Try to be especially mindful of processed foods, canned soups, and salty snacks in the evening, since these often contain far more sodium than people realize. The fifth step is to keep a simple symptom diary for a couple of weeks. Write down how you felt each morning, along with your blood pressure reading if you have one. This small habit gives your doctor real useful information rather than vague memories, and it can reveal patterns you might not notice otherwise. The sixth and most important step is recognizing when something is an emergency rather than a daily inconvenience. If you experience sudden chest pressure, shortness of breath, sudden weakness on one side of your body, slurred speech, or confusion, this is not something to wait out. Call emergency services immediately. These are signs of a possible heart attack or stroke, and minutes matter more than most people realize in these situations. I also want to be clear about something important. These symptoms are not something you should try to self-diagnose at home. If you are noticing these patterns regularly, please bring them to your doctor and ask for a proper evaluation. A short conversation and a basic check could prevent a much more serious event down the line, and there is no harm in asking questions that turn out to have simple answers. I also want to touch briefly on the bigger picture, because morning blood pressure does not exist in isolation from the rest of your daily habits. What you do the evening before genuinely affects how your body behaves the next morning. Going to bed at a consistent time, avoiding heavy or salty meals late at night, and limiting alcohol in the evening can all make the morning surge gentler and more manageable. Even something as simple as a short walk after dinner has been shown to help regulate blood pressure overnight. Staying physically active during the day, even with light activities like walking or gentle stretching, helps keep your blood vessels more flexible over time, which directly reduces how harshly they react to that morning surge. You do not need intense exercise to see benefits. Consistency matters far more than intensity, especially for seniors who are managing other health conditions at the same time. Stress management also plays a bigger role than most people expect. Chronic stress keeps cortisol levels elevated throughout the day, which can make the morning surge more pronounced and harder for the body to regulate. Simple practices like deep breathing for a few minutes after waking, or even just sitting quietly with a cup of tea before starting your day, can make a noticeable difference over weeks and months. I also want to encourage you to involve your family in this conversation. Many seniors live alone or spend mornings without anyone else around, which means symptoms can go unnoticed simply because no one is there to observe them. If you have children, grandchildren, or close friends who check in regularly, let them know what signs to watch for. Sometimes the people around us notice patterns we are too used to seeing in ourselves to recognize as unusual. I want to leave you with this. As we get older, our bodies communicate with us differently than they used to. A feeling you might have dismissed years ago could mean something different today. Paying attention to these small warning signals is not about living in fear. It is about giving yourself the best possible chance at staying healthy, active, and independent for years to come. The patient I mentioned earlier, the woman who almost ignored her morning dizziness, is doing well today because her daughter pushed her to get checked. That is the kind of outcome we want for every single person watching this, and it is entirely achievable with just a little more awareness and a willingness to ask for help when something feels off. Keep monitoring your blood pressure regularly, take your medications consistently, and most importantly, do not wait until something feels serious before reaching out to your doctor. Small, consistent habits, built one morning at a time, are often what make the biggest difference in the long run, and they are far easier to maintain than most people expect once they become routine. None of this requires drastic changes overnight, just small, steady adjustments that add up meaningfully over time. Sometimes a small piece of information shared at the right time can genuinely protect someone you love. Staying physically active during the day, even with light activities like walking or gentle stretching, helps keep your blood vessels more flexible over time, which directly reduces how harshly they react to that morning surge. You do not need intense exercise to see benefits. Consistency matters far more than intensity, especially for seniors who are managing other health conditions at the same time. Stress management also plays a bigger role than most people expect. Chronic stress keeps cortisol levels elevated throughout the day, which can make the morning surge more pronounced and harder for the body to regulate. Simple practices like deep breathing for a few minutes after waking, or even just sitting quietly with a cup of tea before starting your day, can make a noticeable difference over weeks and months. I also want to encourage you to involve your family in this conversation. Many seniors live alone or spend mornings without anyone else around, which means symptoms can go unnoticed simply because no one is there to observe them. If you have children, grandchildren, or close friends who check in regularly, let them know what signs to watch for. Sometimes the people around us notice patterns we are too used to seeing in ourselves to recognize as unusual. I want to leave you with this. As we get older, our bodies communicate with us differently than they used to. A feeling you might have dismissed years ago could mean something different today. Paying attention to these small morning signals is not about living in fear. It is about giving yourself the best possible chance at staying healthy, active, and independent for years to come. The patient I mentioned earlier, the woman who almost ignored her morning dizziness, is doing well today because her daughter pushed her to get checked. That is the kind of outcome we want for every single person watching this, and it is entirely achievable with just a little more awareness and a willingness to ask for help when something feels off. If this video helped you understand something new about your own health, please share it with a family member or friend who might benefit from it. If you would like more straightforward, practical health guidance like this, subscribe to this channel and turn on notifications so you never miss an important video. Take care of yourself, prioritize your health, and I will see you in the next video.